Castellano Antidate, I will perform the head-to-toe assessment segment number 1, which include from the head and face, mouth, nose, and ears. First, in assessing the patient, first you need to do is to take the health history of the patient. When the patient is in the hospital or asking or seeking for a consult to a nurse or to a doctor, usually when the patient asks, it usually starts with open-ended questions like, what are you doing in here or why? And then, and also, you can ask the patient to ask yes or no question like, do you smoke? After taking the health history of the patient, you can get the vital signs of the patient. His apical pulse, the radial pulse, respite, and his blood pressure. Then, and you can also get the blood pressure of the patient. Always remember, when taking the blood pressure of the patient, you can take the blood pressure of the patient in 3 ways. Sitting position, supine position, and standing position. Then, after that, you can start the head-to-toe assessment of the patient. Now, I will start assessing the patient's head and face. In assessing the head and face of the patient, the head and face of the patient is in normal and in its symmetry, and also the hair color, the color of the hair, of the hair is not oily or in normal. Then, assessing the head-to-toe assessment, you are always use the EPA, like the inspection, IPPA, the inspection, palpation, precaution, and observation. In head-to-toe assessment in segment 1, in assessing the head of the patient, first you need to assess for the normal size, its symmetry, and the contour of the head of the patient. Then when also assessing the hair of the patient, you assess its normal deviation. If the patient's head is, hair is dry or oily. And then when you assess the scalp of the patient's scalp will be pink, mobile, and free of scaly units or lashes. When assessing the scalp of the patient, you are going in this manner. Assess the lobe of the patient, the frontal lobe, the parietal lobe, and here in the lower part of the ear of the patient. Then after assessing the scalp of the patient, you also need to palpate the temporal artery. When palpating the temporal artery, we will use the otoscope to auscultate the roots. Always remember when palpating the roots, it can be heard in negative. Next is you will palpate the frontal and the maxillary sinuses. Frontal sinuses can be found in the eyelid of the patient. Ask the patient to close his eyes. Please close your eyes first. then palpate it. Then also palpate the muscular sinuses that can be found here in the cheek area of the patient, or the cheekbone area. When palpating the frontal and the muscular sinuses, there shouldn't be pain and tenderness when palpating it. Then after palpating it, also palpate the trigeminal nerve of the patient here in the lower of the ears of the patient. When palpating the trigeminal nerve, there shouldn't be also pain, then tenderness, and also palpate for its symmetry. Then, when assessing the trigeminal nerve, ask the patient to open and close his eyebrows. Sir, can you open and close your eyebrows? Then, after that, ask the patient to smile widely. Then, puff out his cheeks. Cheeks means. Then, ask the patient to cleanse his jaw. When you ask the patient to cleanse his jaw, you will ask the patient to cleanse his jaw while you will try to open his mouth. Sir, can you cleanse your jaw while I try to open your mouth? No. Close your mouth. Close your mouth while I try to open your mouth. But when I try to open your mouth, please do not open your mouth. Do not ask the patient to taste like sweet or sour food. I will ask the patient to close his eyes. Sir, can you close your eyes? Thank you. Then, can you open your mouth? Widely. Then, I will insert sir, a spoon. Then I will let you identify what food that I let you taste. So, I want to ask you, what did you taste?
Sorry.
Okay, thank you, sir. Then, after that, we will assess the eyes of the patient. When starting to assess the eyes of the patient, we need to assess first the patient's visual acuity by the use of the Snellen eye chart. Using the visual acuity of the patient by the use of the Snellen eye chart, I will ask the patient to close his other eye while the other one is open. Okay, sir, can you close your left eye with the use of your palms? Sir, this is the Snellen eye chart. I will let you read the letters, then I will let you read the letters, then please read it to me, sir.
E F P P O G E P E D P E C F D E D F C G P F A L O P Z D B E F P O P B, C. E, F, O, B, P, C, T, F, D, P, L, T, C, O, E. P, E, Z, O, L, C, F, E, D.
Then, sir, I will want you to read again the smaller eye chart, but only the highlighted numbers.
A, F, P, T, O, Z, P, E, F, D, C.
Assessing the face of the patient, to assess the sense of the patient, you will use a cotton or a wet wipes if there is no cotton available. Then let the patient close his eyes. Sir, can you close your eyes? Then you will put the wet wipes into the corner of the patient, and then let them say if yes I if yes there is I can feel the wet wipes. Sir, can you feel the wet wipes?
Yes.
Okay, then also put the wet wipes in the sinuses of the patient. Can you feel the wet wipes, sir, in your upper eyelids?
Yes.
How about here in the cheekbone here?
Yes.
Okay. And this is to test for the senses of in the forehead of the patient, and also in the maxillary sinuses and in the frontal sinuses of the patient. Then also, after that, test the lacrimal gland of the patient. Palpate the lacrimal gland for any invasions or tenderness or if there is pain. Then the patient should cry. Eyes of the patient, you need to assess for its symmetry. First, you will ask the patient to close his eyes. Sir, can you close your eyes?
Yes.
When the patient's eye is closed, you should note that the eyes is closed and it is aligned in both ears. Eyes of the patient, you need to assess for its symmetry. First, you will ask the patient to close his eyes. Sir, can you close your eyes?
Yes.
When the patient's eye is closed, you should note that the eyes is closed and it is aligned in both ears. Then after that, can you open your eyes again, sir? Assessing the eyes, assess the upper eyelid, palpate the upper eyelids, which is partially covers the iris. Then the eyelashes is outward. Then when assessing the oculomotor nerves of the eyes, you will palpate the eyes of the patient. Can you close? Palpate for the tenderness, then for if there is pain, and then for pain. Then after that, can you open your eyes again, sir? Then you should note that in normal eyes, when assessing a normal eye, the eye must be the right symmetry, which is aligned to the ears, and then the conjunctiva is pink, and then the sclera is white. Then after that, you will use the 6 cardinal sensitivation, which is you will point a finger, then you will stand to the patient 12 inches from the patient. Then you will let the patient follow your fingers from right upper, right middle, right lower, then to the left lower, left middle, and then left upper. Sir, can you follow my fingers?
Yes.
Then after that, for testing the eye accommodation of the patient, you will point again a finger, and then you will ask the patient to look to your finger, and then look to the object um, from behind the examiner, and then the patient will look back into the examiner's fingers. Sir, I will let you ask to to look at your fingers, then 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 look to the object behind me, then again and look to my fingers. Can you look? Can you look then to the object behind me?
Yes.
In this, when assessing with this accommodation test, the patient's eyes must not move to the his eyes from left or to the right side. Then assessing the pupillar reflex, you will use the pen light. You will from 12 inches, you will stand from 12 inches far from the patient, and then you will light the pen light, and then will can you look straight, sir, ahead? No, straight ahead. Okay, sir. Then you will note, you will see a reflection of the light in both eyes. So it means normal. If there are any no reflection in the eye, or in the cornea, in the cornea, it means that the cornea is not normal. Then in pupillar reflex, you will use otoscope or a pen light if there is no available otoscope. In the pupillar reflex, the room should be dark, and then you will again ask the patient to look straight ahead. Assuming that the room is dark, then you will ask the patient to look straight ahead. Then you will light the pen light. Assuming that the room is dark, then you will see that when the room is dark, you can see that the patient's pupil will constrict. Then assessing the pupillary reflex, when using the otoscope, you can see a red reflex, and then this is red orange. And then after assessing the eyes, always remember that when assessing the eye, in the macula, always inspect the macula last, because if you will inspect the macula first, because macula results from the shining of the pen light, or the light of the pen light, it could cause tearing of the patient. So it means it can alter the examination. So it should be that the macula would be inspected or last. Then is assessing the ears. When assessing the ears, you should assess its symmetry, no pain or no tenderness. Then the ears of the patient, both ears of the patient should be aligned to the eyes of the patient. Then when assessing the ears of the patient, we are going to use the ophthalmoscope. Ophthalmoscope. I'm so sorry. Otoscope. Otoscope. Well, for the ears is ophthalmoscope. In assessing the ear, there are any test or hearing test, the voice test or the whisper test, then the Weber's test and the Wright's test. So in the voice test or whisper test, you will palpate the left ear of the right ear of the patient, the left ear of the patient. Then you will palpate it and pinch it, and then you will whisper slightly and softly, and then the patient will say yes if the patient is able to hear what you whisper. Okay, then after that, in Weber's test, we will put the tuning fork. Assuming that there is a tuning fork, behind the ears of the patient, first you will struck the tuning fork, then you will put it behind the ears of the patient, and then the patient will state that yes, I can hear the vibration of the tuning fork. Sir, can you hear the vibration of the tuning fork?
Yeah.
Okay, then for the rhymes test, you will put the tuning, you will struck again the tuning fork, and then you will put the tuning fork above the head of the patient, and then let the patient say yes or no if the patient is able to feel the vibration of the tuning fork until the vibration is gone. Can you feel the vibration, sir?
Yeah.
And that's all for the hearing test. You will ask the patient to smile, and then kiss the patient's tooth, and then you will see the normal tooth receipt of the patient is 4 out of 32. You will assess for its color, symmetry, and note if you can find any abnormalities. Then from the teeth of the patient, you will open the mouth of the patient. Sir, can you open your mouth? With the use of the pen light, you can also assess the mouth of the patient. Assess for any lesions or any scaling, and then the vagus of the patient. You can see the vagus of the patient. Then the uvula, the hypoglossal, after that, you will assess the tongue of the patient. Sir, can you open your mouth? You can inspect the mouth of the patient with the use of a pen light and with the use of the tongue depressor. Then, we will place the tongue depressor from both sides of the tongue of the patient, and you will ask the patient to move his tongue from the direction towards the direction of the tongue depressor. Sir, can you move your tongue towards the direction of the tongue depressor? Okay. Then to the other side. Note that from the both sides of the tongue, the tongue of the patient, there is equal from moving the tongue depressor, from moving the tonsils, the tongue of the patient toward the tongue depressor. And then you should you should also note when you assess the tonsils of the patient with the use of sunlight, you should see that if there is um, one if you see one tonsils, means that negative one for grading the tonsils, but if you can see more than one, you can grade positive one or more than one. Then after that, documentation. Then after the mouth, you will assess the nose of the patient. When assessing the nose of the patient, assess for any tenderness, inspect for any tenderness, and then assess for any pain, then assess for extremity. First, you will ask the patient to occlude his nose, his left side of nose. So can you occlude your left side of nose? Then let the patient sniff. Okay. Then to the other side. Okay. If the patient can smell anything or any substances, you will let the patient test the smelling of the patient by letting the patient smell any substances like perfumes, vanilla, coffee, tea, and let the patient identify it. To able to patient to assess the level of identification of patient's smelling. Then with the use of the nasal spectrum, you can see the inside of the nose of the patient. For its if there is symmetry, note for the patient's nose symmetry, tenderness, or pain. Then you should also assess the nasal septum, its deviation, and structures anything. But always note that you could find any deviation to the nasal septum of the patient at its normal. That's all for the